Today, I'll discuss about American Society of Anesthesiologists Physical Status Classification System, that is popularly known as ASA classification system. It is a very old system of classification, but it gets amended time to time. Like this is approved by ASA House of Delegates on October 15, 2014 and last amended on October 23, 2019. So first we'll discuss about what is the use of this classification system. This is a classification system to measure the medical risk of a patient who will undergo a surgery. So the purpose of the system is to assess and communicate a patient's pre-anesthesia medical comorbidities. So it is important for patient as well as anesthesiologists and surgeon. So now we'll discuss the classification proper. First, ASA 1, that is for a normal healthy patient. Example, healthy, non-smoking, no or minimal alcohol use. You have to remember the examples so that you can easily remember the classification. So ASA 1 is for a normal healthy patient. Next, ASA 2, a patient with mild systemic disease. Example, mild disease only without substantive functional limitations. Examples include but not limited to current smoker, social alcohol drinker, pregnancy, obesity whose BMI greater than 30 but less than 40, well controlled diabetes mellitus or hypertension, mild lung disease. So all these categories, all these diseases comes under ASA 2. There is a patient with mild systemic disease. Now ASA 3, a patient with severe systemic disease. If you remember the old classification, one or two lines were more in this classification, that is a patient with severe systemic disease that is not life threatening at all, like that. But the new system, there is only one line in ASA 3, that is a patient with severe systemic disease. Now examples, substantive functional limitations, one or more moderate to severe diseases. Examples include but not limited to poorly controlled diabetes mellitus or hypertension, COPD, morbid obesity, that is BMI greater than or equal to 40, active hepatitis, alcohol dependence or abuse, implanted pacemaker, moderate reduction of ejection fraction, end stage renal disease, undergoing regularly scheduled dialysis, premature infant post conceptional age, that is less than 60 weeks, and history of prior myocardial infarction, cerebrovascular accident or transient ischemic attack or coronary artery disease or stents, that is greater than 3 months, not recent, that is 3 months, minimum 3 months ago. These conditions, these diseases will all comes under ASA classification 3. Next, ASA classification 4, a patient with severe disease, that is constant threat to life. Not only patient is having severe systemic disease, but that disease is also constant threat to life. These conditions will come under ASA 4. And the example includes but not limited to a recent myocardial infarction, that is less than 3 months, cerebrovascular accident, transient ischemic attack or coronary artery disease or stent replacement, that is recent, or ongoing cardiac ischemia or severe valve dysfunction, severe reduction of ejection fraction, sepsis, DIC, ARD or ESRD, that is end stage renal disease, not undergoing regularly scheduled dialysis. These all conditions is constant threat to life. So these comes under ASA 5. Now ASA 4. Now ASA 5, a moribund patient who is not expected to survive without operation. Example includes but not limited to ruptured abdomen, thoracic aneurysm, massive trauma, intracranial bleed with mass effect, ischemic bowel in the face of significant cardiac pathology or multiple organ or system dysfunction, All these conditions needs immediate operation. Without that, patient will not survive. So this condition comes under ASA 5. Now ASA 6. A declared brain dead patient whose organs are being removed for donor purpose. So a patient is already brain dead and whose organs are being removed for donor purpose. So this condition comes under classification 6. So these are the classification. Along with that, one additional E is present, ASA E, that denotes emergency surgery. ASA E denotes emergency surgery. If any stage there is emergency surgery is required, then the patient will classify as ASA E. And according to ASA, American Society of Anesthesiologists, emergency is defined as existing when delay in treatment of the patient would lead to a significant increase in the threat to life or body part. So this is the definition of emergency. Now these were the classification of ASA. It's very important for your exam as well as your army dental exam. Thank you very much.